Kia ora, everyone. Thanks, Grant. I guess I'm looking at the patient in front of me a lot of the time, or most of the time. I don't work in research or anything like that. I'm a jobbing GP, if you like. I previously worked in acute care in hospitals quite a while, and then worked as a GP in London, and then moved here 11 years ago. I worked in a high needs practice for 7 years, and to be honest, it's sort of enjoyable, but it's also quite depressing. As Boyd said, we're not making any headway really on the obesity epidemic and chronic disease burden, and sitting at the blunt end of it, with 15-minute appointments to see patients, it is quite depressing sometimes. So I try and look a little bit upstream, and look at those determinants of health. I've done a bit of Cochrane collaboration work, which is a big evidence-based meta-analysis group that produces guidelines. So I know a bit about reviewing the data and the evidence. A little bit of public health work in London as well. So I do some. When I came across and I'm going to come to it in a bit, the such strong evidence for lifestyle approaches. So if there's medical students listening, I wish that I'd known that in medical school, or it would have been, maybe I didn't listen. But I think the evidence is accumulated so much that the difference that lifestyle makes to that individual patient in front of you, and obviously there's a population basis. So I do some consulting now for people who want to often reverse their disease, or lose weight, or address one of their chronic diseases, or whatever issue it is. So I'd like to reach as many people as possible, and that's what we're trying to do through our nascent small group, really, EBE, through holding talks and symposiums. And we run potlucks once a month at Grey Lynn, for people who want to learn about plant-based diets. We have a speaker, we have a social thing, because as Boyd says, it's about food's a very social, cultural thing, and we share tips, and it often comes down just to those, as Fuchsia was saying, those pictures of food and what you're eating, what you're putting in your mouth at that individual level at that time. I'm very aware of those social determinants of health. I'll show you a diagram a bit later on. But when I see someone, it takes me an hour and a half for people who come and see me for a individual appointment, to get to know them, to get to know their backgrounds, their family relationships, the stresses in their lives, to affect changes. I mean, a lot of what I do in that is just, not just, but it's health coaching. So rather than direct medical intervention. But I guess what I bring to it is I can manage their chronic disease medicines and conditions, alongside dietary and lifestyle advice. So I'm very pleased to be vice chairperson of EBE. A great series of talks around the country. Grant, well done for putting it together. The power of it, as Boyd says, comes from people. Doctors have a significant big voice as well, but doctors can get a bit boring, I think, for the government, in terms of just harping on about chronic disease problems and complaining about the way things are. So the power really comes from people, patients, if you like. And I know I've got several of my sort of patients who are / friends, really, probably watching in tonight. When I came across the evidence for lifestyle and health, and it is so dramatic, it made me, like it does for a lot of people in public health, change my diet entirely. If someone had told me I was following a plant-based type of diet, 10, 15 years ago, I'd have laughed at them. It wasn't on the medical agenda and medical education, hardly taught in postgraduate. When I mention it in my CME meetings, people, almost laugh at me, or don't take it very seriously. And I don't blame people at all. It's the way the way the system's been set up. We have fast 15-minute appointments. We have to turn people over. You can get in brief interventions to try and change people's approach to their health, and build up relationships over time, which is the benefit of primary care and general practice. But it's pretty challenging. And I've got, some interest in the stake in the future. Well, we all do, but we've got a couple of kids who, fully healthy children, 10 and 13 now, fully plant-based diet. And I'm going to come to a little bit of how plant-based you have to be a little bit later on. Obviously the whole world's not going to turn vegan overnight, but as many of the studies that Fuchsia talked about, and I'm going to bring up tonight briefly, indicate we need to move more in that plant-based direction at our individual levels of our food choices. So I guess I'm appealing to people who, the people who really need these interventions won't be listening or won't be here, as always is the case. I'm appealing to people who have a bit of interest in their health, perhaps like yourself, Grant, or Peter, who have conditions they would like to reverse. The risk factors for, our commonest conditions, so heart disease, stroke, diabetes, cancer risk conditions. We can, do a lot to reverse those risk factors and lower your disease risk or reverse your disease. So look, I've got a lot of slides here. Fortunately, Fuchsia's nipped some of them in the bud, so I'll be able to gloss over a few of them because I know time's getting on this evening and people have probably had a lot of time on Zoom during this week. So yeah, I won't mention much about the health problem in New Zealand. We've covered a lot of it. I'm just going to go talk a bit about the evidence of plant-based diets for your individual health, some of the studies for it, some of these disease-specific studies of reversal. I mean, I think these are the most astonishing things. You can actually get reversal, and more in diabetes and other conditions. We've seen reversal starting to become a bit mainstream. But when you start talking about heart disease, as you did, and I know that was your galvanizing factor for really getting on this train, Grant, and these studies have been done. They're hard to do. We always need more of them, but they are there. And when the effect is so powerful, do we wait another 5, 10, 15, 20 years if you develop heart disease before adopting this type of diet? We're talking around a whole food, plant-based type of diet. I won't talk much about practical considerations because Fuchsia's covered some of that. And then the planet. So if you follow the British Medical Journal, yet again, and I know Boyd's been involved with the Eat Lancet Commission. Today's editorial in the BMJ was about promoting diets and health behaviours for being which will also help the planet as well. So a lot of that's about food and other behaviours. Doctors do have and health professionals have a strong voice, and I think it's up to us. It's all our own individual duties to do what we can. And the first rule about this club is to talk about it, obviously, but in a non-confrontational, sort of gently persuasive way, I suppose. I'm just going to start with a case study. Patients come back to me again and again, and it really astonishes me. This has changed the whole way I do medicine, really, trying to put that lifestyle stuff, and particularly the diet, I see as central. But I know there are lots of factors that affect what people choose to eat. But people who are, I guess, relatively health literate and able. So this is one of my patients last year, nearly age 69. I wish I'd started on a whole food plant-based diet even a few years earlier, but no one told me. Those are entrusted my health diagnosis and outcomes after the age of 60 resulted in standard treatment with prescription medicines, an ACE inhibitor that I was already taking, and a statin. No one ever talked to me about my diet or being overweight, obese, despite weighing, sorry, I've lost the edge of the screen there, but despite being significantly overweight in my early 50s at 162 centimetres. In all fairness to the medical profession, they may have been woefully ignorant about the role a plant-based type of diet can play in reversing and avoiding and limiting diseases. So 5 months into a plant-based diet, so excluding animal products, and the other key thing, obviously, as we mentioned before, is it's got to be whole foods. There's lots of plant-based crap out there surrounded by it, and it's responsible for as Boyd says, a very high proportion of the obesity and chronic disease issues we have. But there are some benefits to excluding some animal products from the diet. So her cholesterol reduced from 6.1 down to 4.5. Her LDL, bad cholesterol, reduced very significantly into good target ranges. Triglycerides came down, and that probably reduces her heart attack and stroke risk, by something like 30 or 40%, perhaps more. Lots of people have heart attacks and strokes with normal cholesterols, just because of the way the reference ranges are set. I think expectations are relatively low for what people can do with changing their diet. And 50% of heart attacks occur in people with normal cholesterols. Despite being told at an anaesthetic assessment a few weeks before I'd be on a statin, as high cholesterol is genetic. And she hopes it will go down further. So she reduced her weight down to a weight she hadn't been since she was 20s, or before she was an adult. Sleeping really well, blood pressure came down significantly, able to reduce her cilazapril, blood pressure medicine. People often report feeling good as well, good energy, sleeping well. Obviously, if you lose that amount of weight, everything feels a bit better. But healing from operations, as she says here, and other conditions tend to reduce or go away, such like gastritis and gut issues. So the problem, Fuchsia's shown this slide already. I won't labour through these, but huge long-term conditions taking up probably 80–90% of our health budget. That's where your health dollars are going. Very high obesity rates, comorbidities, very high diabetes rates there. So I'm just going to take the, there we are, a bit better, just minimising that. So I can reach the edge of the screen. Life expectancy for men and women there is still increasing, but healthy life expectancy is not so good. So people are said to be dying longer rather than living longer in some ways, living several years in not great health. In contrast with, as I'll come to a bit later, places such as the blue zone areas around the world, the healthiest, longest lived people, who tend to live and be self-caring and active and even working well into their 80s sometimes and into their 90s, and have the highest number of people living, or centenarians. Touched on equity issues. Mali living about 7.5 years shorter than Pakeha, European, and Pacifica about 5.5 shorter life years. So it's just stuck here. What are the risk factors in New Zealand? We've gone through a lot of them. Blood pressure, obesity, dietary risks, alcohol and tobacco, obviously, high LDL cholesterol. And the global burden of disease studies every 2 to 3 years reports on what our chronic disease levels are, and on what the dietary risks are. And so this is diets high in sodium, low in whole grains, low in fruits, nuts and seeds and vegetables, causing the diseases on the right that kill a high proportion of our population. We talked about ultra-processed foods making up a very high percentage of our calories in New Zealand from quite a young age, from up to 12 months of age, and high salt intake, low fibre, high red meat and processed meat intake relatively. And people might have seen this before, the wider determinants of health, understanding the causes of the causes of the causes of diseases. And Boyd's talked about those, so I won't talk much about it. So lifestyle medicine. So for any of the medical students listening, wish I'd known this, wish I'd been taught about it. It is always at the top of guidelines for treating diseases, but it's a small section. I don't feel it's treated that seriously. a few platitudes around healthy diets. You can't do much in a short appointment, I think, is the bottom line, which is how 90% of our health point of care episodes are with primary care. So some really good studies showing impact of healthy lifestyle factors on life expectancies in the US. So the nurses and health professional studies, 5 healthy lifestyle factors. If you had all of those, the healthy diet, not smoking, not excess alcohol, normal body mass index, and some exercise, you'd have a 74% reduction in risk of dying, 65% reduction in risk of dying from cancer, 82% reduction in cardiovascular disease, and prolonging life expectancy, 10 years of extra life expectancy free from major diseases. So really, really significant studies showing the benefits of a healthy lifestyle. And similar from the UK, 80% of chronic disease and premature death can be prevented by adopting these healthy lifestyle behaviours. So diets kill more people than tobacco globally now, as the global burden of disease study has shown. And how does it do that? What are the effects? What happens at the molecular level? Well, we have dyslipidemia, so high cholesterol, high blood fats, oxidative stress, that's reactive oxygen species from unhealthy foods, causing inflammation, the unhealthy gut microbiome, more and more becoming apparent about the role of the trillions of bacteria that live in our gut in terms of our immune system and regulation and reducing inflammation, and abnormal cell growth that can lead to things like tumours and cancer. And there are a lot of good studies showing the benefits of swapping animal for plant proteins, and they've really been put into a lot of national and international guidelines. So in the nurses and health professional studies and cohorts in Japan, showed that replacing even 3% of total energy in the diet from animal protein with plant protein can significantly reduce mortality for a number of causes, in the order of 20 to 30%. And there's a number of these substitution studies out there now describing similar benefits. So how would plant-based diets help? Lowering inflammation, as I said, less oxidative stress, healthier gut biome, lower obesity rates. So fibre and water tend to be the things that fill us up. So if you're eating, there's no fibre in any animal product at all. So each time you're eating meat, fish, dairy, chicken, eggs, you're forfeiting some fibre in your diet. And obviously, if you're eating ultra-processed foods, a lot of them may have had the fibre taken out of them. So plant-based diets have that low-calorie, high nutrient content, phytooxidants, antioxidants, etc., phytochemicals, sorry, avoiding carcinogens, healthy gut biome, and improved hormone profile, particularly for female reproductive cancers, such as breast and uterine. What foods have been shown to promote health? Well, in the Greek EPIC cohort, if we look at this graph here, if people aren't familiar with reading it, if the bars to the left of the zero line show improved or reduction in mortality of death rates, and the ones on the right increased death rates. So vegetables, legumes, fruits, nuts, to a lesser extent cereals, and the healthier fats, mono and unsaturated fats. To the left, alcohol, meat, dairy and fish have been shown to be associated with increased mortality rates. And the PREDIMED study, which is the study that put the Mediterranean diet on the map, or one of them that helped promote the Mediterranean diet. So trials adding either olive oil or nuts showed a decrease in combined cardiovascular events, mainly due to reduction of stroke in the nuts group, but no overall reduction in mortality. So they then analysed the data in the PREDIMED, differentiating between the unhealthy plant-based foods. So many of these may have been ultra-processed foods, with the nutrient stripped, fibre lost, and added, fat, salt, and sugar. And if they differentiated those, so you can see the three lists there, and they created a diet index of healthy plant foods and unhealthy plant foods. And when they looked at this pro-vegetarian type of diet, the more pro-vegetarian, healthier diets had lower disease rates. As you can see, these 5 quintiles. So on the far right-hand side have the healthiest outcomes. There have been studies of the Mediterranean diet, which is probably the most recommended diet these days for sort of mainstream health professionals, against a low-fat or a whole food plant-based type of diet by Neil Barnard's group in Washington. Showed that the vegan diet resulted in better weight loss, lower cholesterol, improved insulin sensitivity, but had slightly less impact on blood pressure. And in these big meta-analyses from these really big cohort studies that I've got listed on the right-hand side there, they've got the plant-based diet index here in general and its effect on all these diseases. And you've got the healthy plant-based diet index separated here from the unhealthy, so more processed plant-based foods. And what you can see really, this basically says you need to eat whole foods, which is what we know, but you obviously need to demonstrate it in these studies. So if you had the unhealthy plant-based diet, you actually could increase your coronary heart disease risk, diabetes, kidney disease, fatty liver, and all-cause death. So you can't get away. Vegan's great for the planet, perhaps, and obviously for animal welfare, but you can't get away with having Coke and chips and Oreos as a mainstay of your diet. That is what this shows. But just coming back to it, but very significant reductions on a healthy plant-based diet of all these diseases in these major studies with hundreds of thousands of people involved. So each on the left rather than on the right. It's hard because it's a slippery slope. If you have a bit of the stuff on the right, you want more of it, because we're all in the same bodies that evolved a couple of million years ago, and we all crave fat, salt, and sugar in case we think we're going to die tomorrow. So personality and lots of other factors come into people's ability to withstand the onslaught of processed foods. Specific studies on vegan health. And we got the Adventists health study from the Seventh-day Adventists in around North America, and the EPIC Oxford cohort with a large number of vegetarians or vegans included. Although some of the Oxford studies don't come out as one might expect with vegetarian or vegan diets, they seem to have a low amount of fibre and not a particularly healthy type of vegan or vegetarian diet, whereas the Adventists have a healthier type of diet. I'll cut through here. I'm just going to show you through these graphs. So this shows that all-cause mortality, which is on the left of the one line there down the middle. If you look right at the bottom of that triangle there, this is an odds ratio plot summarizing all these studies above, weighting them all according to size and quality of the study. And it's well to the left of the bar on the left, showing reduced all-cause mortality in vegetarians against health-conscious omnivores on a sort of healthy mixed diet, standard diet. It also shows that the vegans are the only group with a healthy BMI in the Adventist health studies. So a healthy body mass index is 25 or less. And the lacto-ovo vegetarians, pescatarians, semi-vegetarians, and non-vegetarians all had elevated BMIs. Diabetes prevalence goes down the more plant-based, if you like, the diet in the Adventist health studies. So you can see it goes down stepwise on these charts. Reduction in blood pressure, very similar. And reduction in heart disease, quite significantly to the left in vegetarians. And the EPIC Oxford and EPIC Europe vegetarian studies also show lower rates of ischemic heart disease, diabetes, and at least 18% less overall cancer rates. And that brings me to the blue zones. Many of you may have heard about them. These long-lived, healthy people that have been, analysed now for what they eat essentially and their lifestyles. Different places around the world, in the Seventh-day Adventists in California, the Nicoya Peninsula in Costa Rica, a couple of areas in the Mediterranean, and then the Okinawans. And they all have a lot of healthy lifestyle features, behaviours, social, regular, constant movement, social engagement, lower stress, no time urgency there in Okinawa. But right at the centre of it is a plant-centred diet. So often 90–95% plant-based so they all eat a bit of meat, fish, pork or something like that, depending on what part of the world they're from. But it's small amounts, and it's not the centre of the plate like we often have it here. It's the condiment or the flavour, and not every day. So yeah, this is the guide. If you go onto the Blue Zones website, there's a lot written on their healthy behaviours and ways you can eat like a Blue Zone person. So Loma Linda in California has one of the highest life expectancies in the world, 10 times more likely to live to 100 than typical Americans, 10 years longer than the national average. And just across the road in San Bernardino, they've got the opposite. They've got a much poorer socioeconomic group there, because the Loma Linda Hospital serves both populations, and they have quite a diversity of people who come into it. So our plant-based diets, I suppose we need more studies on them. Whole food plant-based, is it acceptable and does it work? Luke Wilson and Nick Wright's excellent study based in Gisborne in quite a relatively mixed, poorer socioeconomic group. These are hard studies to do. They had 65 patients. This was just published a couple of years ago. They all had either elevated BMI and one of the diseases you see there, diabetes, heart disease, hypertension, or high lipids. And they just had education meetings or teaching on following a plant-based diet for 3 months. 75% completed the study to 6 months, and up at 12 months, 70% were able to be followed up, showing quite good adherence to the study. It's very hard when the end of a study happens. People often go their own way if it's not successful. So it's a mark of the success of the study that people stuck to it. So they had statistically significant differences in cholesterol reduction at 3 months and at 6 months in the subgroup analysis. Reduction in cardiovascular risk score at 3 months, decreased medication use, increase in the intervention group, increase in the control group quite significantly. And it's really nice to be able to deprescribe. As doctors, we tend to just add another pill to people's lists until they're on 10, 15 pills sometimes if they have comorbidities. So it's great to be able to take pills off people. They really love it. And very significant weight reduction, such that this was actually, to their knowledge, that achieved the greatest weight loss of any other trial in the medical literature that doesn't limit energy intake or mandate exercise. Good thing about it, there's no calorie counting, no portion control. The diet is satiating in itself by the fiber and the water content. So people, can eat ad libitum, so as much as they like. And this study, this chart from my friends Malcolm and Jenny, I show patients to show where the calories are in their food. These are all obviously whole foods. But if you eat to the left, the green side of the chart, you tend to lose weight or plateau. And the more food you eat to the right-hand side, and obviously processed foods, you tend to increase weight. And this works by the satiation effect of stomach distension being the #1 thing that stops us eating more calories than we need. So interventional studies. People often say, this is Prof. Dean Ornish, who's done reverse heart disease and reverse early prostate cancer studies. This was published in The Lancet initially in 1990, before I went to medical school. And one might have thought it might change the way people approach cardiology. To date, I've only met one cardiologist in New Zealand, Patrick Ladding, who trained in Cleveland with one of the other reverse heart disease authors, who knows about trying to reverse heart disease with diet. So Dean Ornish had 48 patients with known coronary heart disease, shown on angiography, followed up for 5 years. No cholesterol lowering medication was used. And 82% showed regression of narrowing of their arteries, so atherosclerosis, at 1 year. And further regression was demonstrated at 5 years. This is shown radiologically. So these are really hard studies to do, to put someone on a diet. They also had the other, sorry, I should have said that other factors such as exercise was involved, stopping smoking, which obviously can make a significant difference, and stress management. But really significant changes there. To reverse heart disease was, unheralded really, until this time. And I see a number of people who've read Ornish's study. You can read his book. I mean, Bill Clinton famously did it, and just come for counselling on and manage of their medical conditions, the medications, etc. Who followed the Ornish diet. This just shows the change. People who didn't follow the diet or just in the control group had increase in clogging up of their vessels, as you'd expect, going upwards there on the chart. And the treatment group had slow regression, so slow opening of their coronary arteries. That's pretty significant. So, people like to be told they've got another option other than just medications and procedures. It gives them power and they can take it into their own hands. Not everyone's able to do it. Not everyone's in the right, mental space or I guess is good enough at cooking or can feel they can change their diet. But the people who can, get very significant clinical symptoms and potentially if you were to do angiography, which you wouldn't do unnecessarily, you could demonstrate it radiologically like Ornish has. Well, Esselstyn, who has a good Radio New Zealand interview with Kim Hill from several years ago, you can still listen to. He's done something similar in the Cleveland Clinic. This was just an interventional case series of 198 patients. And as you can see in the angiogram on the right, a number of them had radiologically demonstrated regression of the clogging up of their artery. You can see that the Widowmaker artery there, showing a very moth-eaten portion, and by itself, with no other medication interventions. A number of them were shown to have opening up of their heart blood vessels. So to get the investigations is hard. To do angiography and to do these PET scans is really hard. We obviously need more of these kind of studies. It's hard to fund them. There's no money, and funding dietary interventions, eating whole foods and healthy foods. There's money in drugs and procedures, unfortunately, and that's just the way the system is. So, my message to people is to, if you know someone with heart disease, is to give them the option. Not everyone wants to do it or can do it, but just giving people the option. So for other diseases, Barnard's shown reversal of or improvements in diabetes scores in an RCT. I won't go through all the details, but people can look it up who are interested in it. A lot of people are doing reverse diabetes studies now, but often they're on quite miserable calorie limiting or liquid diets. Whereas to be able to eat healthy whole foods ad libitum as much as you like is a real bonus of following a plant-based type of diet. And there's a number of groups around the world doing this. So the Mastering Diabetes groups of Cyrus and Robbie are quite well known out of the States. And I encourage people to read it if they're trying to reverse their diabetes. Cancer and diet. Significant studies showing reduction in cancer risk. So 17% increased risk with red meat and 18% increase per 50 gram of processed meat has been shown, such that the World Health Organization declared red meat to be a probable carcinogen, group 2A, and processed meat is a group 1 confirmed carcinogen. And various means of components of the foods, heme iron, heterocyclic amines, N-nitroso compounds, these quite well demonstrated harmful elements of eating meat or cooked meat or additives to meat. And Ornish has shown reversal of early stage prostate cancer. It's hard to do these sort of studies on other cancers because you obviously have your surgery or have your radiotherapy or chemotherapy pretty quickly after diagnosis, hopefully. With early stage prostate cancer, there's a watch and wait because it's a slow, indolent type of cancer. And he was able to demonstrate over a couple of years reduction in PSA score and cancer volume. I'll show you in the next slide. And also increase in telomerase, which is a marker really for reduction in cancer activity. And on the right hand side there you can see the red heat map before the intervention, before changing diet, going to green, showing reduction in oncogenic activity, so cancer promoting activity. This is an MRI scan of someone's prostate with prostate cancer, showing a reduction in PSA from 6.5 to 4.5 and corresponding reduction in cancer volume. So it's pretty cool stuff, really. If I had prostate cancer, I'd want to know about it. I want to have that option. And the WHO and the World Cancer Research Fund have, as you can see on the left, have a whole food or a diet rich in whole grains, vegetables, fruits and beans as a big part of their prevention and also post-diagnosis for people with cancer. It's been shown people have improved survival curves with healthy lifestyles, particularly including healthy diet and of the nature of a healthy plant-based type of diet. Because plant-based diets address the root of the cause, so reducing inflammation, as I say, oxidative stress, insulin resistance, improving gut biome, gene expression, addressing the short telomere issue. They're like the fuses of the end of the DNA. The more they unravel, the more trouble you're potentially in. DNA damage and hormone dysregulation. And many people are taking it further. We need more studies on all of these things, obviously, on specific diseases and diet. They're hard to do and get funding for, but more and more people around the world are I suppose, looking at the evidence and saying, well, it's good enough to start recommending it to people. So Chiba in Japan recommends a plant-based diet and has shown remission or improvements in what is an epidemic of inflammatory bowel disease around the world now with Western diets. It starts with writing up case reports, like in the bottom left-hand corner, Alan Desmond's group in the UK. You write one case report, you write several, you have a case series, and then hopefully someone takes notice and you can get proper interventional studies funded. But a number of groups, and there's an Auckland-based group, High Carb Health, who regularly post remission or improvement, great improvement in symptoms of inflammatory bowel disease, this nasty inflammatory condition that affects people at a young age and ruins their life, and they often end up with surgery or stomas or awful problems. Multiple sclerosis, probably one of the best studies I've come across in medicine in terms of how hard it must be to do it, in Portland, Oregon. And George Jelinek, who was an ED professor in Melbourne, but now his main thing, after he overcame his multiple sclerosis, which is this inflammatory, degenerative, unpleasant neurological disease that classically women get in their 30s or even younger, and tends to progress in a high proportion of people. And his 34-year-old study showed the best intervention, or best results of any intervention for treating MS. And I've come across a number of people who have their MS in remission. I spoke at the MS Research Day a couple of years ago, and a number of people were onto it, but a lot of people didn't know about it. But if you don't give them the option, they'll never know. And the thinking is behind this is the reducing the amount of saturated fat and something in the mechanism of saturated fat metabolism and inflammation that triggers in genetically predisposed people MS. A bit like for inflammatory bowel, if you've got the genes to predispose you, having an animal-based and perhaps processed food diet just tips the balance to give you that disease compared with someone else. And there is a journal now, the International Journal of Disease Reversal and Prevention, has been created really to, as the name says, to put case reports in of often conditions that you wouldn't think are reversible or improvable with diets, renal conditions, lupus, heart disease, lymphomas. And this is how it starts really. As I say, you need to write case studies, get case series, and then people start to take note. That's how medicine's evolved through the decades anyway. I won't talk about the nutrients because Fuchsia's covered all of it, but you must take B12. You've got to watch your calcium. There's this risk of increased fractures for people not getting enough calcium in their diet. Fuchsia covered some of that in her talk. Protein tends to take care of itself if you eat a sensible diet, and she covered iron and the other micronutrients there. So the consensus is building towards plant-based diets. All these organizations now recommend it specifically, including, interestingly, Kaiser Permanente, the biggest health insurer in the US, because they've done the maths and they realize that actually saves money for people to take care of themselves and reduce their claims. So they now specifically recommend a plant-based diet and have a program people can go on. The Canadians are onto it. They've got dairy out of the beverage of choice. They've got half fruit and vegetables, optional animal foods as part of their protein section, and whole grains. I'm just going to come to COVID. I'm actually working in the quarantine hotels at the moment. COVID is really picking off, unfortunately. This is what I see every day when I'm sending people to Middlemore or wherever from the hotels, as they start to desaturate and get a bit unwell. It's picking off people with chronic diseases and inflammation largely. As it shows here, 64% of hospitalizations in the US were attributable to heart disease, obesity, blood pressure, or diabetes. And that's not a full list of all the chronic diseases out there. So a very high proportion of people who are getting COVID, getting sick, have been shown to have underlying chronic diseases. Plant-based diets, pescatarian diets, and COVID severity, 73% lower odds of moderate to severe COVID infection with a plant-based diet, 59% lower odds with a pescatarian diet, so it's a fish-inclusive diet, such that they said these diets may be considered for protection against COVID-19. And interestingly, low carbohydrate, high protein diets had a 3.8 times greater odds of moderate to severe infection. And the ZOE study, Tim Spector's group in London and Chan in Harvard, found something similar. People with the highest diet quality, 10% less likely to develop COVID, and 40% less likely to become ill. So, you know, I wish they'd stand up at the 1 p.m. pressos they have and say, well, the other thing you can do, by the way, is look after yourself and eat healthily and have, you know, try and eat a healthy diet if you're really worried about this, as well as obviously smoking and alcohol, but you know, self-care, things people can actively do rather than sit at home worrying, yeah, if they're going to get it and get sick. So we'll just jump through this. So I won't spend much time on other diets. I mean, there are lots of ways to lose weight and even potentially improve your cholesterol, blood pressure, and other parameters. But they tend to have higher mortality rates long term in the big studies. So, you know, it's published in the Lancet Public Health journal, showing mortality increased 18% when carbs were exchanged for animal-derived fats or protein, and decreased when substitutions were plant-based. So a high-carb diet risk was associated with refined carb intake. So it shows there that the very highest carb containing diets were refined carbohydrates, unfortunately, ultra-processed foods. I won't go through keto. There's, you know, it's people tend to make their own choice with diet depending on their pre-existing, I guess, preconceptions. But there are good studies showing improvements with a plant-based diet compared with keto. And I was always going to mention about the effect of diet and health. Or planetary health, sorry. Our house is on fire, loss of biodiversity, loss of the forests. Animal agriculture is the leading cause of species extinction, ocean dead zones, water pollution, habitat destruction. It's a particular problem for New Zealand, which has a disproportionately high carbon emission burden compared with other countries. Yeah, and without decisive and urgent action, the climate crisis will increasingly undermine human health and disrupt healthcare delivery, both moral and practical reasons for health professionals to be at the forefront of climate action. Yeah, doctors do have a voice, and I think it's up to all of us in the healthcare professions to stand up and say something about it. This is the Lancet Commission that Boyd was involved in, the planetary health diet. So balancing people's health with planetary health, and a high proportion of whole grains, vegetables, fruits, and optional smaller amounts of animal proteins and dairy foods, different types of fats, less saturated fat, more unsaturated fats, and reducing sugars. And some foods are win-win. So this tends to be the four plant-based sort of groups of foods: fruits, vegetables, whole grains, and legumes. So they're beneficial for people's health and the planet. Barriers to adopting a plant-based diet: knowledge, cultural norms, worry about loss of enjoyment of types of food they like to eat, or are, you know, vegetarian diet's going to be enjoyable. Once people have tried, they often come back and say they didn't realize how easy and how enjoyable these sorts of foods are. Worry about nutrient deficiencies, and with a bit of education, people can allay those fears, or advise people what to eat. And healthcare professionals. I certainly didn't know anything about this 10 or 15 years ago. So in conclusion, there's a large body of evidence to support plant-based diets for preventing and treating chronic disease. National and international guidelines are catching up with the evidence, and human and health and diet patterns have to be considered in the context of global planetary health. So thanks very much. It's quite late in the evening now. Anyone's got any questions?
Maybe just one or two. You're right, it is getting a little bit late. But thanks for that. That was a really good overview of a heck of a lot of material there. It was really good. Well done. Question, anybody? Put your hands up if you want to. Just look at the page. No, it looks like you answered every question, Mark. It looks like everybody's quite happy with what you said.
My work is done.
No, as I say, you covered a lot of territory there, and there was a lot of good stuff there. Well
we did
done.
have one person, Lee, ask about advice when kids are plant-based, but all their friends eat rubbish, especially at high school.
Yeah, you've got two boys. What do they do, Mark?
Just what was the question again? What for kids? Just
how do your kids avoid the rubbish food when the kids are when their friends are all...
Kids can't, or many adults can't. In terms of processed foods, I mean, we're all as, I mean, I tell people they have to have their blue line foods they just don't touch or don't eat. So it's chips, chocolate, you know, you just have certain things as an adult. It's hard though, you know, we're busy, stressful lives. We use food rather than for hunger, satiating hunger. We use it for tiredness, boredom, stress, you know, pleasure. It's you know, my kids will take, they for the planet and for animals' sake, they wouldn't eat animal foods. They find it sort of... Yeah.
Be good if there were some alternatives to junk food, though, but I'm not sure what you'd have except fruit. Lots of fruit.
I mean, drowning out the unhealthy food with healthy stuff, I think, is probably the first thing. So if you fill yourself up with healthy foods during your meals or snacks first, I think that's the thing.